Hi, I'm Maggie Hange here from the Minnesota Catholic Conference. We just testified in opposition to an IVF insurance mandate that was heard over in the House. There's been 3 hearings on this week so far. This was House File 1758. We have a lot of concerns about IVF. We've been sharing those. I have here with me Renee Oakes. She also testified in opposition to the bill during the hearing. Renee, do you want to share a little bit about who you are?
Yes, I am a fertility care practitioner and the founder and owner of Integrated Fertility Care Center in Stillwater, Minnesota. I am also the director of Marriage, Family, and Life for the Archdiocese of St. Paul in Minneapolis.
Thanks, and thanks so much for being here. We, like I said, we have a lot of concerns about IVF, about the practice. We have a lot of ethical concerns about it. Babies are created in a lab. Mass numbers of embryos are destroyed. Some embryos undergo pre-implantation genetic testing. Babies are ranked. So there's just a lot of ethical concerns about it. But one of our other concerns that we've been really highlighting this week is it's just not best medicine. It's not best practice. A lot of couples undergo multiple rounds of IVF without ever achieving pregnancy. It's really expensive. But they can go on to achieve pregnancy by treating really the root cause and getting to the root cause of deeper issues that are causing infertility. Because we know that infertility in itself is not the disease. It's showing that something is off in your body. If your body is healthy, a baby will come. If something is off, a baby won't. And Renee is really can speak to this really well. So Renee, do you want to share a little bit about what really is real care and best practice in this regard?
So a little introduction to who I am. My husband and I have experienced 24 years of infertility and recurrent miscarriage. We've lost 5 of our babies. And we have both female and male factor infertility. So I understand the cross that infertility and recurrent miscarriage is profoundly. And that's why I founded Integrated Fertility Care Center, to really be a sanctuary to actually treat the root cause of infertility and to see those babies flourish. And in all the years I've worked in fertility care, I only have had 2 clients who did not go on to conceive.
So tell us a little bit about what processes your clients use when they are trying to figure out why they're not able to conceive, why they're getting those negative pregnancy tests month after month.
So a huge part of the efficacy of restorative reproductive medicine, and specifically NAPRO technology, which is the realm that I work within, is data collection. That there's information contained in a woman's cycle that is information that we couldn't gather anywhere else. So that information, when imparted on a chart, that can then be used to time lab tests, to time surgical procedures, and to guide the effectiveness of the treatment that's being undergone. You will see when proper treatment is undertaken and full treatment has actually occurred, you will see a change in that data collection, in that charting. That's the measuring of the success of what is being undertaken.
Thanks for that. So then after someone starts charting and sees different things or whatever method they're trying to use, what would be the steps? So like, for example, you could go to your regular primary care physician and get some labs done, but they might do it on certain days, like day 3 or day 21, or something standard. What would be the steps? What's different? And this is really, we're highlighting this because this was a big discussion today, and that's been a big discussion in the past. What is different that you can see by charting, and why does that matter to really pay attention to your body first and not just do kind of that standard of care that that your physician probably will direct you to do?
Mm-hmm. So there's a dramatic difference from one physician to one physician. So, and the care that they might offer. If you go to a standard medical facility, so if you go to a standard medicine provider, so an OBGYN, they will often do hormonal testing, lab tests, that are based on a general guideline. So for example, a day 21 lab. If you are, that day 21 is hopefully timed a certain number of days after the date of ovulation. If you are like so many women today that are struggling to conceive, myself included, that date of ovulation might be as late as 20, day 24, day 28. And if you're only doing a day 21 looking at that hormone level, that in the hopes to see that, yes, ovulation has occurred and that progesterone levels are high enough, that's going to be entirely inaccurate. the utilization of charting is specific to that specific woman, that specific cycle, because even cycle to cycle there's variance. So one cycle you might ovulate on day 14, the next cycle you ovulate on day 12, the next cycle you ovulate on day 20, and there needs to be that movability with the lab work and the testing to be an accurate representation of what's going on in the body.
That's so helpful, and this is one of the reasons why we are trying to promote restorative reproductive medicine, why it's a big talker out there in different channels and things, because it really is a tailored approach. We have problems with the IVF, obviously the ethical ones that I've already mentioned, but it seems to be a one-size-fits-all approach. Restorative reproductive medicine is a tailored approach, can look at the women and figure out what she specifically needs that might be different than the next patient that they see. So it's really helpful to hear that you found hope in your patients to be able to help them achieve pregnancy. My understanding is even patients who had undergone cancer in the past were able to achieve pregnancy by using some NAPRO technology and other charting mechanisms to be able to see what's going on and try to treat them. So I think the message here is there is hope. Something can be done. The IVF insurance mandate, despite being, or in addition to being hugely expensive, isn't always the best approach for couples, but there is hope. A lot of people feel very hopeless. It takes time, these things are stressful, but that's why the church endorses restorative reproductive medicine. So in closing, is there anything else you want to add or share for our audience?
In all the years that I've worked in fertility care, I have not seen a case that was harder than my own. I have every single case, every single disease process that causes infertility and recurrent miscarriage except for 2, and my husband is clinically infertile as well. If we can do it, and we can go on to conceive 8 times, we have 3 living children. If we can do it, anyone can do it. NAPRO technology is 80% effective when used with the cooperating fertility care of Creighton Fertility Care. Those 2 things really are the greatest window we have into a woman's health, and with cooperating urological treatment for our men and their issues, because there is male infertility 40% of the time, we can have a positive result. The key is lifelong health, not just the achieving of one pregnancy, but in fact, the achievement of many, many pregnancies, including a lifelong health and vitality. So I encourage anyone who is interested to learn more to look at the research done at the St. Paul VI Institute out of Omaha, to look at the statistics and what's been published in all the major medical journals, and also to look at the CDC's most recent reporting on the effectiveness of IVF, which is actually quite ineffective. The most expensive fertility treatment and the most ineffective, even though it is often stated the other way, that in fact medical care is the best way to achieve healthy pregnancies.
Well, Renee, thanks so much for being here. Thanks so much for testifying in committee. It's so helpful to have subject matter experts like Renee show up at the Capitol, engage in conversation and dialogue with our legislators, and help educate on what will really help the common good. That's what we try to do here at the Minnesota Catholic Conference. Thanks so much for being here.